After a week of multiplying COVID cases, how are hospitals coping with the influx of patients? That big question and more with Dr. Jonas del Rosario of the Philippine General Hospital. Dr. del Rosario, thank you for joining us and welcome back to The Big Story.
Good evening, Ed, and to your televiewers.
Yes.
Thank
Doc,
you for having me.
Thank you for joining us, Doc. Doc, let me start off with this. Yung revision sa policy na yung healthcare workers who test positive for COVID-19, their isolation has been reduced to only 5 days from 10. Now, I understand the strategy there being the concern na baka maubusan tayo ng tao sa mga ospital kung sakaling mag-spike nga. Pero I suppose it's a bit of a gamble. How are we sure or are we certain that, number one, the workers who tested positive will be cured already by the 5th day? And number two, would they have the strength to go back to work on the 5th day?
Well, alam mo, Ed, even in PGH, we are adjusting our isolation and quarantine protocols. It is because of this crisis, almost about 80% of our manpower are either infected or quarantined because of either exposure or getting the disease itself. And if you follow the conventional guidelines, halos wala na po matitirang healthcare workers. So we have to adjust. Yes, we have to make sure that very important is in our protocol, if you are infected, you have COVID, we still follow the 10-day. You have to be isolated for 10 days. So that's very important, making sure that you are not infectious and you have fully recovered. And then there's also some leeway being given to our safety officer, to the head of the unit. They still also have to assess that healthcare worker, if that healthcare worker is really fit to work already. The big change really happened dun sa quarantine, kasi again, we have so many healthcare workers now who have been exposed. Some have high-risk exposure, some have low-risk exposure. Yung high-risk exposure kasi there was a time, 14-day quarantine. That's almost 2 weeks of asking them not to go to work. So pilay na pilay po ang mga ospital. So now there's a new directive from our director that we really have to shorten the quarantine. In fact, if you're asymptomatic and you have high exposure, we don't even have to test, and then if you are symptomatic, we swab you. If it's negative, then you also go back to work already.
Yes, Doc. Pero Doc, in this particular case, the new policy is from 10 days for those testing positive na healthcare workers, it's now down to 5 days. Kinalahati po eh. Which also, of course, that does raise the question, are they well enough to go to work and not be infectious to begin with? Again, like I said, we do understand the need to ensure that there are enough people in the front lines. But at the same time, it could be a gamble that they could still be infectious.
Apparently, CDC actually had these guidelines. 5 days, after 5 days, they can go back to work and they have to be wearing their masks. And they deem that these people are not infectious anymore.
Okay. Doc, one last question lang po, if I may. Kamusta po ang PGH? How is your occupancy? Are the numbers getting alarming?
Yeah, we had a steady increase of patients coming in. For the December 25, our lowest recorded number of admitted patients was 30. And then after almost 2 weeks, we're up to 250 and counting. And then also there are a lot of patients coming into our emergency room. So much so that we have to start reopening some of our COVID wards again. The only limitation that we have right now po is the manpower nga dahil madami po nagkakasakit at maraming na-expose. And that's the reason why we have to modify our isolation and quarantine protocols. Otherwise, hindi namin matutugunan yung we need to open more facilities for the COVID patients. At the same time, there are also a lot of non-COVID patients. So we're feeling the surge po, Sir Ed.
Okay. Doc, ingat po parati at maraming salamat for joining us tonight.